So this is a phase 1 study in evaluation of this molecule, which is called NVG-111 in relapse-refractory CLL and Mantle cell lymphoma patients who had at least 2 prior systemic therapies and have achieved a partial response or a stable response to the last line of treatment. Because it's the first in human study, our main focus is to look at safety, but obviously we're also evaluating the efficacy as well. And we want to see what would be the recommended phase 2 dose that we would take it to a phase 2 level. Now, in this abstract, we are presenting data on our first 6 patients. The very first patient we had we started on a very small dose, so we only had the cytokine response, but no response on efficacy. But of the remaining patients that we have treated, 2 patients, one patient had undetectable MRD result in bone marrow and in peripheral blood, and one of the patient had undetectable MRD in peripheral blood and very low level detectable disease in bone marrow, and some of our other patients have still got detectable disease, but they've had good reduction in their disease levels. And one of the patient is a mantle cell lymphoma patients, and the rest are CLL patients. So the early signs of efficacy and evidence of response in all the patients, apart starting from patient number 2, the toxicity is manageable and predictable. We are now evaluating slow dose escalation to see what is the best dose to take it to a phase 2. And we are also evaluating step-up dosing and as a monotherapy without combination of the background therapy to see how patients would respond to this drug as monotherapy.